patient safety starts from the time the patient enters the hospital and till he gets out of the hospital. So what all things we can do in order to reduce the unsafetiness? What all things happen when the patient comes there? There can be errors in doing some drugs administration. There may be an accident, there may be injuries, or they can have an infection which the patient doesn't need to happen. So we can prevent by having multiple levels of the team plan as well as the communication, which actually can reduce these kind of errors. There are two major important grading system which has been followed all over the world. One is a leapfrog grading system as well as the letters grading system. All are formulated in such a way that to reduce the errors in the patient's treatment. Okay, so we have to recheck the drugs. Normally what happens is two people will be involved in taking the drugs, rechecking it a couple of times before administering to the patient, so that we don't have a wrong drug administration to the patient and causing problem to the patient. And if there's antibiotic and certain drugs which the patient are having allergic history, we need to actually properly evaluate the patient for the allergy history and then give a titrated dose to see whether there is any allergies there, and then give the right drug. Okay, so without some drugs should not be administered without doing a test dose. From the anesthesia point of view, there are certain things which we can try to reduce the unsafety for the patient. One is when the patient comes to the hospital, so you properly evaluate the patient, okay, by asking the proper history of the patient, having any allergy history or any kind of an unwanted anesthesia complication happen for the previous surgery. So we can actually ask this in history, and then this is called the pre-op evaluation of the patient, okay. And after that, if they have some kind of the systemic disease, we can actually prepare the patient properly and then make to a normalized level and then take up for surgery. And the most important thing in this anesthesia part is the consent. Okay, so we need to take a proper consent by educating the patient about what is going to happen and what type of anesthesia is going to be performed to the patient, and then make them understand what we are talking, and then familiarize this one when they come to the OT, so they don't have any questions to be asked. So that's very, very important. Educating and communicating to the patient are the golden standard for the safety of the patient. And when the patient is on the table, we do a sign in and a sign out, which is called time sign in. Sign in is exactly what happens is when the patient comes to the OT table, we make a general check of that this is the same patient who is coming for the specified surgery. And then if there are two organs involved, like two kidneys, so we actually ask the patient he has come for which side the surgery is. So rather than doing a mistake of operating another side, so we recheck again and then make sure that everybody is on the same line. Okay, so this is called the sign in, which involves the patient also when we chat. So it's basically from the anesthesiologist, surgeon, as well as the patient along with the OT staffs. Okay, and once the patient has been induced and before the incision is done, the surgeon again asks whether this is the same patient coming for kind of a laparoscopic cholecystectomy or this one to recheck, and then this is the double check which normally we do. So when we do all these kind of things inside the OT, we will actually reduce the unwanted things like errors in the OT. Okay, so this is another safety which is important.